data on private equity transactions is very opaque.
Mm.
It doesn't exist other than what private equity firms want to sort of publicly announce. And so that is a huge barrier to research in this area. So what we've done over the past several years and building on this sort of research platform is we hand comb data on transactions. And we verify that with press releases, with industry reports, with verification from clinic websites. And what we did was we looked at what private equity transaction look like in behavioral health specifically. And so we found that private equity owns between 6 to 7% of mental health clinics and substance use treatment facilities in the country. But these penetration rates really vary a ton by states. So in some states, North Carolina, Colorado, Texas, private equity owns more than 25% of all facilities in those states. And this is pretty consistent with other recent and burgeoning evidence. There was a study that sort of accompanied our study at the time by researchers at Yale and Penn that found that private equity owns about 14% of all freestanding psychiatric hospitals. And then another descriptive study that was published last year by some colleagues of mine found that private equity owns on the order of like 29% of all opioid treatment facilities, opioid treatment programs in the country. And those belong to just 11 parent companies, each owned by just 1 to 2 private equity firms. So what we're seeing is that private equity is entering behavioral health pretty rapidly. They're consolidating very quickly. And it's not, a little bit here and there. It's actually, a substantive amount. And then finally, we know that private equity, not just in the areas that we've studied, but they've invested in autism services, where there's a lot of coverage mandates now for applied behavioral analysis. And that's introduced some predictable revenue streams and consolidation opportunities. Private equity is also a dominant player in residential treatment disorder, residential eating disorder treatment centers.
Mm.
But we don't really have a lot of data on these other sectors of behavioral health. It's just, we're still early days, I would say, in the first 5, 10 years of investment in these